Today we'll be discussing Introduction to General Anatomy. So, what is general anatomy? General anatomy discusses the general features of the structure of a human body. Anatomy is basically a branch of medical science that deals with the cutting up of a human body for studying purposes. It is a field of medical science which deals with the study of the structure of different parts and organs of the human body. Be exact. The main divisions of anatomy are the gross anatomy, histology, and embryology, which is also called the developmental anatomy. Gross anatomy is the macroscopic anatomy. What we can see through our naked eyes is the gross anatomy, the gross structure of the human body. Microscopic anatomy is also called histology. It deals with the finer details of the body, and these are only visible through a microscope. Developmental anatomy is also called embryology. It deals with the study of human development before birth. As you can see, through starting from a small fertilized egg till the grown embryo, this is the developmental anatomy. Other divisions are the regional anatomy, which discusses the human body uh, by regions like the upper limb, the lower limb, the thorax, abdomen. The functional anatomy, the systematic anatomy is through systems, the cardiovascular system, the respiratory system, etc. The functional anatomy is through the functions of the different organs and structures. Surface anatomy is that we mark various structures on the human body. For example, the human heart is we will give example that starting from this point till this point is human heart inside the body. This is the surface anatomy. Comparative anatomy is that we compare different structures and functions and then study the anatomy. Radiographic anatomy is the study of structure of human body through the radiographic images. Surgical anatomy is the study of structure of human body for surgical importance. Applied anatomy is the clinical aspects of the structure of human body. Now, we will discuss general anatomy and it deals with the general features of the human body. Regional anatomy, we can see this is the upper limb, the blue is the upper limb, the pink one is the lower limb. These are various regions of the human body, and this trunk has the thorax and abdomen and the pelvis, and this is the brain. Now, systematic anatomy, I have told you the various systems. Functional anatomy is the correlation of the function of any organ or part of the body with its structure. Surface anatomy is that we can see here, this is the marking of the stomach inside the human body. We are seeing the stomach on the surface of the human body. This is surface anatomy. Comparative anatomy is that we compare the anatomy of humans with those of animals. This is the radiographic anatomy. This is surgical anatomy. This is applied anatomy is that the clinical oriented anatomy. We compare the structure and function in accordance with the clinical implications. So first of all, we'll discuss the anatomical position. Anatomical position is that the body is standing erect with the face, palms, and feet facing forwards. This is the anatomical position. We can also discuss, see the anatomical position and lying down position that, for purposes of description. That when we study anatomy on a cadaver, the cadaver is not standing erect; it is lying on a table. So the face, the palms, and the feet, the tip of the feet, the tip of the toes, they are pointing upwards. This lying down position is also called the anatomical position. The planes of the human body are the median plane, the sagittal plane, the coronal plane, horizontal plane, and the oblique planes. We'll discuss these one by one. So median plane is the one that divides the body into two equal halves. This green one is the median plane. You can see that it is dividing the human body equally into a right half and a left half. The sagittal plane is another median plane, but that is not lying in the center of the human body. It is lying parallel to the median plane, and it is also dividing the body into a right half and a left half, but these are unequal halves. The coronal plane is also called the frontal plane. It divides the body into an anterior half and a posterior half. This blue one is the coronal or frontal plane. You can see in this picture that it is dividing the human body into an anterior half and a posterior half. Now, horizontal plane is also called the transverse plane, this pink one. It is dividing the body into an upper half and a lower half. Oblique plane is any plane that is dividing the body obliquely into two halves. Now, the various terms we'll be discussing throughout anatomy, we'll discuss them. These are the anterior or the ventral position. Anterior is the inside, at the front is the anterior, and at the back is the posterior. Anterior is also called ventral, and posterior is also called dorsal. Medial is towards the center of the body. Lateral is away from the center of the body. Superior is on the upper side. Inferior is towards the feet. Superficial is that is closer to the skin surface. Deep is that is away from the skin surface. Internal is inside. External is outside. Proximal is a structure that is present nearer to a reference point. For example, if we talk about this elbow joint, anything that is close, this part of radius, the bone that is close to the, that is proximal is the head. Head of the radius is proximal, and the distal end is at the farther point away from the reference point is distal. Palmar is the palm. Dorsal is the back of palm is the dorsum of the hand. Plantar is the sole of the foot. Now, various terms of position are flexion, extension, abduction, adduction, medial rotation, lateral rotation. We'll discuss these one by one. So, what is flexion? Flexion is bending of a structure, and it mainly decreases the angle. And flexion happens at a joint. So in this position, we can see if this is the shoulder joint. If the arm goes anteriorly, it is flexion, and if it goes posteriorly, it is extension. Same is the case with this lower limb. If there is bending at the knee joint, this is flexion, and if there is straightening at the knee joint, this is extension. Here, if the head is moved forward, this is flexion. If it is moved backwards, this is extension. Now we have discussed the extension along with the flexion. Abduction is moving the limb away from the median plane. So if we move the arm away from the center of the body, it is abduction. If we take it back towards the median plane, it is adduction. Circumduction is a combination of all these movements: the abduction, adduction, flexion, and extension. So the arm moves in a circular motion. This is called circumduction. Rotation is movement in a circular central plane in the long axis. If we see this head is moving to in from right to left, if the head is moving, this is the rotation. Supination is the mainly this term is used in the forearm region. It is occurring at the proximal and distal radioulnar joints. These are the radioulnar joints. This is the distal radioulnar joint, and this is the proximal radioulnar joint. So if the in supination, the radius rotates outwards and the palm of the hand is facing anteriorly. In pronation, the radius moves inwards and the palm of the hand is facing posteriorly. Inversion is typically for foot. If the movement of the plantar surface of the foot is towards the median plane, it is inversion, and if it is towards the outside, it is eversion. Plantar flexion and dorsiflexion are the two movements at feet. Dorsiflexion is the movement of the foot where the dorsum of the foot moves towards the leg, and plantar flexion is the movement in which the sole of the foot moves towards the posterior surface of the leg. So this is dorsiflexion, the upward movement of the foot, and this is plantar flexion, the downward movement of the foot. Protraction and retraction is mainly for the mandible or the jaw. The movement of the jaw anteriorly is protraction, and movement of the jaw posteriorly is retraction. Elevation, the closure of the mouth is elevation, and opening of the mouth is depression. These are also the movements at the jaw. Opposition is the movement of the carpometacarpal joints of the thumb. The approximation of thumb to the tip of other fingers is called opposition. Now we'll discuss various terms of laterality. We all know that bilateral means on the two sides, unilateral means on one side, ipsilateral means of the same sides. For example, the right arm and the right leg are ipsilateral, and contralateral is of opposite sides, right, left arm and the right leg, or the right arm and the left leg, these are contralateral to each other. That's all for today. Thank you.